A healthy aging testbed in Queenstown is set to expand thanks to what NUS describes as a significant donation from a philanthropic family when giving. The funding will support the Health District at Queenstown initiative, which develops programs to help residents stay healthy and independent as they age. It also aims to scale successful ideas across Singapore. And for more on the initiative, I'm joined by Professor John Eu-Li Wong from NUS. He's also co-chair of Health District at Queenstown. Professor, firstly, how did this initiative come about and what have you learned from the research you've done?
Well, thanks very much, Mr. Sung. Singapore has great policies and we rank very highly in multiple global indices. But we are faced with the same challenges as the rest of the world. As lifespans increase, the number of years in which Singaporeans are in good health is lagging behind. And the concern is that this gap may actually be widening. So we need to develop real-world interventions that can close this gap. And our research has shown that there are areas that we can improve on, and our interventions are designed to address where there are gaps.
And another question is, why Queenstown and why was this chosen as the starting point of this initiative?
Well, okay, so Queenstown, we happen to be sitting in the district. So firstly, I would like to share with all the viewers that this is the Urban Redevelopment Authority, the URA's planning zone. It's not the political constituency, it's the URA planning zone of Queenstown. It's about 21.4, 21.7 square kilometers. And it's actually a microcosm of the whole of Singapore, demographically, especially demographically by this year or next year as Singapore becomes super aged. Queenstown is already super aged. So it meets the criteria of demographically comparable to the rest of Singapore, the ethnic composition, and very important, the socio-economic profile. So this is a mini Singapore. And our research, we have validated this by looking at other parts of Singapore. And we're seeing that what we are seeing as strengths and challenges are the same as the rest of Singapore. So it's a great test bed.
Now, you mentioned ethnic composition, and we understand that the research focuses on the Malay Muslim community in Queenstown. What insights can you share from your study?
Okay, so firstly, we are addressing all the ethnic groups. We're addressing all the ethnic groups, but we're very grateful to One Giving because one of One Giving's gifts goes specifically towards the Malay Muslim community. So we've got several programs running. One of our initial programs was looking at who we felt was a key person in the Malay Muslim household, and that is the mother. So we are concerned that what we call the sandwich caregiver, very often the Malay Muslim woman is looking after two generations. She's looking after her parents, she's also looking after her children. And that the significant stresses on the Malay Muslim female caregiver leads her to neglect her own health. And once we lose the Malay Muslim female caregiver, the whole family structure becomes very unstable. So based on that research, the One Giving gift is we're really trying to develop culturally grounded models looking at preventive health and how do we make sure that our preventive health strategies are culturally grounded.
Now, there were research as well, collaborative research with institutions, including HDB, international institutions like Columbia University. Can you give us an example, an idea of some co-designed health programs that have made an impact?
So firstly, the Health District at Queenstown is still young. We're officially 5 years old. So it takes time for programs to develop. But two of our programs, which are looking very promising, these are prototypes. And the physical prototypes have only been in existence for just over a year. So we have one in just close by in Block 160, Mei Ling. This is a blended care team which is embedded in Block 160 with the primary goal of developing a trusted relationship with the residents. And it's called a blended care team because it involves healthcare professionals as well as social service sector. And the programs are co-designed with the residents. In fact, the residents named the site. It's known as Happy Village at Mei Ling. So that's focusing on trying to address gaps in physical, mental, and social well-being. The other prototype, which is also looking very promising, is in Margaret Drive. Again, named by the residents. It's called Come for Tila. It's playing on the fact that it's at Block 40 Margaret Drive. And that's led by NUS, and that's looking at how to build social capital. Because social capital is very important for winning the trust of people so that you can look after physical, mental, and social well-being. And so these are two prototypes which have been physically in existence for now 1 year, and both looking very promising. The qualitative feedback from residents has been very powerful. The qualitative input we're getting from agencies and the political office holders is very promising. So again, if the quantitative data matches the qualitative data, we'll be looking at scaling these, firstly in different parts of Queenstown to confirm that we can see the same signal, and then the playbook will be there for the rest of Singapore.
Now, Professor, very quickly, I need to ask you this. There's a term that's constantly used called healthy longevity. Can you explain that to Singaporeans?
Sure. So healthy longevity is the state in which the years of good health approach the lifespan, with the ability to stay active physically, mentally, and socially. That's healthy longevity.
Thank you very much, Professor, for sharing the insights of your study. Thank you.
Thank you very much.
And we've been speaking to Professor John Eu-Li Wong from the Health District at Queenstown Initiative.